This is a recording of this year's Virtual Residency Fair. We'd like to take the time to thank the programs that volunteered their time to present to this year's applicants. This year's PM&R Scholars Virtual Residency Fair is supported by PM&R Recap and Ultrasound Guidance. PM&R Recap is the leading resource for your physiatry board preparation, clinical preparation, audition rotations, and beyond. PM&R Recap offers 35 hours of review videos, hundreds of review questions, and oral board cases to help you become the best physiatrist that you can be. Head to pmnrrecap.com to learn more. Ultrasound Guidance is the innovative new online ultrasound learning platform that gives you instant access to expert instruction. With rapid scans and complete scans of every joint and peripheral nerve, Ultrasound Guidance is the perfect way to jumpstart your MSK ultrasound learning. Visit ultrasoundguidance.com to learn more.
Awesome. Hey, everyone. My name is Dr. Nick. I am our Associate Program Director here at the University of Kentucky. Trickling in, we'll have Dr. Key, our Program Director, and our Chief Residents will also be joining us. I'm going to go ahead and share the screen and we'll get started. All right. Can I get a thumbs up reaction? Make sure you can see it.
We see it.
Awesome. Good deal. So again, welcome everyone. So this is us. These are our awesome residents. This is from our last academic year. We will be taking a new picture here soon, but this is us, and it's a great group certainly to work with, and looking forward to hopefully someone from this call being a part of our residency program. So here's what we're going to talk about. So we're going to talk about the program. We're going to talk about the resident schedule and what you expect each PGY year. We're going to talk about our wellness initiatives, didactics, and our mentorship programs that we have. And then we're also going to talk about two of the main locations where you end up doing your rotations, the Chandler Hospital and Cardinal Hill Rehab Hospital. And then we're going to talk a little bit about Lexington. So here's our program leadership. So Dr. Susan McDowell is the department chair, and then our department vice chair is Dr. Salas. As I mentioned, Dr. Jamie Key is our program director. Leslie is the heartbeat and keeps everything running. She is an amazing program coordinator and does such an awesome job for both myself and Dr. Key, and then for all of our residents. And then I'm our APD and our research advisor. Got to give a special shout out to our chief residents. So Dr. Albritton is our academic chief resident. Dr. Jamel Hill is our wellness chief resident. And then Dr. McDermott Schneider is our administrative chief resident. So they are now settled into their roles and doing a great job. So here is a little snapshot of our residency program. So we are a 4-year categorical program. And then outside of our residency, we also have a couple of additional programs. So we have a brain injury fellowship. We currently have Dr. Zeems, who is one of our previous PGY4s, who is now our brain injury fellow. This year, we also have a partnership with our colleagues down the road at University of Louisville. Dr. Demick, who you see pictured here, is doing a dual spinal cord injury fellowship, spending half of his time with us and half of his time at University of Louisville. And then fingers crossed and hopefully coming soon, we have applied and hope to be an osteopathically recognized program. So we'll talk a little bit about what that means for our residency should we get that recognition. We have 6 residents per year. We recently had a complement increase. Last match cycle was our first year of 6. And so we are looking forward and awesome to have that complement increase and growing our residency. So what are some of the benefits? So as a PGY1, you receive both the Bradham and DeLisa textbooks. As a PGY2, you get Cucurullo and then 2 texts related to PM&R. If you want to do interventional pain, and there's an interventional pain text that you would like to utilize, that can be one of your texts. So as long as it's related to PM&R, can be one of your 2 texts. We also have laptops that you get, and then, I'll be honest with you, it's so many different texts: oral board prep, a complete anatomy app, a TBI text. you get a plethora of resources, both electronic and from a book standpoint. And then as a PGY3, you get a $600 education stipend. And this can be used for different workshops at conferences or different workshops with different organizations if you so choose, or if there is some type of educational resource that is going to help you in your career, you can utilize that. And then as a PGY4, you get a $1,400 lump sum educational stipend. This is intended to help offset the cost of boards, or it could also be utilized for a board review course. You also get 2 paid conferences. You go to AAP as a PGY3, and that is sponsored through the department. And then also you go to AAPM&R as a PGY4. And then in addition, you also get to go to another conference during your residency. So that could be to the American Osteopathic College of PM&R, pain conference, sports medicine conference. So at a minimum, you as a resident at the University of Kentucky get sponsored to go to 3 conferences during your residency. Now, there is also the potential where if you're involved in some high-level research and get it accepted at a conference, there are other opportunities to get sponsored as well with some high-level research. And so that's pretty rare, I will say, to have so many conferences, but we know how important it is for you and your career. And we also know that networking and going to conferences, you're also a representation of us. So we think going and networking nationally is really important. Also, you get personalized scrubs and white coats every year, and then you also get a food stipend and free parking. So let's break down our rotation. So as I mentioned, we are a categorical program. And so your intern year, PGY1 year, is with us. And so here's the breakdown. And honestly, it is kind of broken down as a transitional year. So you get 4 rotations in internal medicine. You have 1 rotation with neurology that is split between the stroke and general services. You get 1 rotation in the neuro ICU. Then you also get a 1 rotation, and a rotation is a month. So 1 rotation with inpatient orthopedic surgery, and then 1 rotation with outpatient orthopedic surgery. You also spend a month over in outpatient pediatrics. You spend 2 weeks with sports medicine and 2 weeks with interventional pain medicine, and then also 1 month with trauma surgery and 1 month in our PM&R clinic. So I will tell you, I am biased when I say this, but I would definitely put our PGY1s up against anyone at the end of this year. It is certainly not an easy year, but it will definitely prepare you well as you go in and hit PGY2 year. So now let's talk about PGY2 year. So as a PGY2, you have about half of it being inpatient and half of it being outpatient. I will mention that that is something that is a little bit unique. I know some programs have a lot of heavy inpatient PGY2, but you know, we certainly understand that, you know, as your intern year, you're going to have a lot of, you're going to be, sorry, I see a chat here. Let me see. Oh, so
Thanks, Dr. Nick. I'm manning it.
all right, awesome. Thank you. We understand that if you do 2 consecutive years of inpatient, burnout is a really real thing. And so we're very cognizant of that. And so that's why we split it up. So you have stroke and brain injury, 2 months a piece of those. You also have an elective, and we have a slide next in a couple of slides talking about what rotations you can do for an elective. You also have about 4 months of clinic that is split between the Cardinal Hill Clinic or the UK clinic, so the PM&R, and then also the Cardinal Hill Pain Clinic. And so those are a mix of rotations where you will spend time with Dr. Brock Mars, who's one of our interventional pain PM&R trained interventionalist. And then also in our Cardinal Hill Clinic, we have a very robust MSK side, and then also a neuro rehab side. So in both of those different aspects of our clinic, We're doing Botox injections, intrathecal baclofen, ultrasound guided injections. We're also doing nerve blocks, phenol injections. We also are doing cryoneurolysis for pain related to spasticity, and then also pain related to NEOA or what have you. Also doing some hydrodissections and such as well. And so we do some pretty high level injections, both on the MSK and neuro side, that I think is an awesome opportunity for residents. Also, as a PGY2, you spend 2 months at the VA musculoskeletal or polytrauma clinic. So this is where you are treating patients that are veterans that have suffered blast injuries, have musculoskeletal concerns. It's a very robust experience for our veterans and really helps them out. And then also we have a month of amputee rehab. And so this is a combination of both an inpatient and an outpatient experience. Moving on to our PGY 3-year. So you have 2 months of spinal cord injury, 2 months of general rehab. So this is where a lot of polytraumas or hip replacements, knee replacements, etc., that you get that experience with. Also, as a PGY3 and a PGY4, you go to the VA and are involved in the amputee clinic and the consult service. You also do 2 months of pediatric rehab. You also get an elective. And then kind of finishing up here, you get 1 month on the teaching utility team or the TUT team. You get 2 rotations back in the PM&R clinic. And then you also have a float rotation. So I need to explain 2 of the 3 bottom ones. So the TUT service, or our teaching utility team, is intended to be a inpatient rotation where you are the junior attending. So that is where you and the attending are looking at pre-screens and talking about how to sign what are called IPOCs and the aspects of being an attending that you may not get as a PGY2. So then that way you get that experience and you know what it's like to be an inpatient attending. So it's like you're a junior attending. The float service is a new rotation this year that we're really excited to have for the residents. And so what this float rotation is to help when residents go on vacation or some extra help is needed on inpatient or some help is needed on outpatient. And so, right, we all know when vacations are. Dr. Schneider does a great job of communicating when residents are on vacation. And so instead of the other residents having to cover for someone that's on vacation or someone that is sick, the float resident can go in and can essentially assume that role where the resident is gone. And so it helps burden someone being gone, whether that is for illness, vacation, etc. And then if no one's out, then you get the opportunity to go down and help in clinics, see injections, etc. Then lastly, as a PGY4, so this is also when you get some additional EMG exposure. You get that both in your 3rd and your 4th year. You go also to the VA and you're involved in their EMG clinic. You go to 2 rotations in the teaching utility team. Then you have 2 to 3 months of acute care consult with Dr. Anna Carrico over at Chandler Hospital. You also have an elective month, a float month, and then you go back to amputee rehab. So that's a breakdown of all of the rotations per PGY year. I mentioned electives on each PGY year, and these are all of the potential options that you could utilize that elective for. So sports medicine, interventional pain, you wanted to go back to inpatient. Some of the ones that I will mention is you can do a hospice or palliative care elective, a cancer elective, a research elective. You can also go and do an elective through the Global Health Brigade. So this is a picture. Dr. Salas, who's our vice chair, and Dr. Natali, or just recently, here is their Global Health Brigade trip. Dr. Natali had nothing but awesome things to say about her trip. And then also, if you so choose, you could also do an elective in OMM. And what I mentioned down here and what I mentioned in the first couple of slides is that we have submitted our application to be osteopathically recognized. So what that entails is that not only would you be a PM&R resident, but if you so choose, and you want to enhance your osteopathic manipulation skills, there is essentially a separate program that you would do in addition to being a PM&R resident. So that's in separate OMM didactics, and you would also incorporate that in your Cardinal Hill clinics, being with our OMM providers. That would include myself, Dr. Funsale, and Dr. Byron, who all do OMM. And so it's something that we're really pleased to offer for both DO and MD, MBBS colleagues. And so I think this will be awesome. Fingers crossed. We should hear soon when that application is reviewed. So we're really excited to offer that as an additional program and experience for residents. We also like to have fun. So here is a picture of a recent retreat at Activate Lexington. We also have some astute golfers. If you notice, 3 out of the 4 people here are Chiefs. So apparently if you golf and if you like golf, you're a Chief. And so here's our astute golfers here. This is some of us at AAP in the rain, at Disneyland. And then here is some pictures. Dr. Key can correct me if I'm wrong. I think this was at an ornament exchange a little bit ago. And then this is for a shower for Dr. Schneider. Here are some other pictures that I have here. So this is again at Disney with our you can see here are some PGY current PGY4s and some recent grads. This was part of our wellness didactics, where we did some yoga as part of our didactic lecture. This here is from one of our community outreach events at Frederick Douglass High School. So this is where we go, as well as several departments with the University of Kentucky, and teach high school students essentially what we do. And so here you can see some Botox models. And so we were able to show students how we inject Botox. And then we also, through this program, have been able to offer some observerships and shadowing experience for students.
Dr. Nick, you have 4 minutes remaining.
Awesome, thank you. So for our didactics, it occurs every Tuesday and Friday from 7 to 9 a.m. You are protected from all clinical responsibilities. So Dr. Key covers the pagers on Tuesday, and I cover the pagers on Friday. And then here is essentially our 16-month schedule. We have I'm a Physiatrist, which is our intro to rehab, anatomy course, our SAE review course, our career development course. So this is where you learn the finances of medicine and how to build a CV and how to negotiate contracts. And then we also have alternating courses with the electrodiagnostics and cardiopulmonary or peds, and then neuro rehab and rheumatology and P&O. Mentoring is always a question we get, and so we have several types of mentorship. So you have a research mentor. I'm your research advisor, and then help pair you up with research mentors and projects that you would like to be involved in. We also have a peer mentorship program where it's resident to resident. And then you also have a formal residency mentor. Your PGY 1 year, your formal residency mentor is Dr. Key. And then as you transition into PGY 2 year, if you would like to, get a mentor that is in a field that you're pursuing, then you could join and have that individual as your mentor. So lots of different layers of mentorship. So real quick, these are the hospitals where we do rotation. So this is Chandler Hospital. It is the #1 hospital in Kentucky for the last 9 years. It's a level 1 trauma center, a level 1 pediatric trauma center, a comprehensive stroke center, and a National Cancer Institute. And then Cardinal Hill Rehab is our freestanding rehab hospital. It's a 232-bed hospital with the outpatient clinic that I mentioned. We have outpatient therapy, 2 aquatic pools, and all the technology that you ever desire for our patients. And then Lexington is the horse capital of the world. You have all those different stats. It's the 8th best city to live in America and the 3rd safest city to live in the country. And then, of course, we have some decent basketball, but I know there are some fan hoods that may debate me on that with our Vols and Cardinal fans on the call. Last but not least, I got to make this announcement. So Wildcat Wednesday is starting in 2 weeks. So this is a big announcement. We've done this now for 4 years. This is a interactive Zoom session to learn more, not only about UK, but about the whole application process. So we understand that we have 6 spots. And so most people applying PM&R, they won't be with us at UK. But at the end of the day, we know that you're going to be our colleagues. And so during these sessions, we talk and provide some interview advice, some personal statement advice, and then also talk about our UK program. So I'll drop the link in the chat. This QR code takes you there as well. And I think I might have 1 minute. Sorry, Dr. Key, for you to say hi. And maybe I know she was having some trouble logging on. So I put the link in the chat. If we'd love for you to come out again. We just want you to be successful at the end of the day. And so any way that we can help, we are happy to do so.